Hello, good morning, everyone. It's a pleasure to be here and to be the first speaker today. And thank you very much for the introduction, too. So without further ado, I'll go into my presentation. As a disclosures of conflict of interest, I work as a consultant for Beckley Psytech, which is a startup company that develops 5-MeO-DMT in clinical trials. I also consultant and board member of two nonprofits, Diachronic Institute and Cactus Conservation Institute, but that has no relation to the work I will be presenting here. And I'm also an independent researcher affiliated with King's College London. In terms of psychedelic psychiatry, yesterday you've heard the introduction, and what I wanted to mention is that serotonergic psychedelics, particularly psilocybin, are actively researched as potential treatments for a range of different psychiatric disorders. And also, there are currently about 230 active trials. I checked in clinical trial registry the other day, and there are a lot of debates about the mechanism of action and how does it work. Is it just structural and functional plasticity? Is psychedelic experience important? What is psychotherapy? How do they all fit together? And there are many debates about that. We as researchers come with our own biases, and I very strongly believe that psychedelic experience is important, and that's why I'm studying psychedelic experiences and try to bring more of them into clinical development. And also, it's very important for basic neuroscience, because neural correlations require insights into subjective experiences. Otherwise, what does it mean? What do those blobs in fMRI or lines on EEG mean without subjective experience? It's also arguably important for therapeutic outcomes, but current first-person approaches have their drawbacks. We talked a bit yesterday about mystical experiences and how to define it, about drawbacks of existing questionnaires, and the limitations of them as well. And also a lot of qualitative research is focusing again on patients' judgments and patients' opinions about it, and not so much the features of the experience. So we need, in addition to all this, approaches that provide more nuance and accuracy in capturing the nature of psychedelic experiences. And to this end, I discovered this method called microphenomenology. It has its roots in phenomenology research, the study of subjective experience, and it's both interview and analysis technique designed to elicit detailed retrospective reports about a specific experience. And microphenomenology specifically was studied in the context of meditation and other contemplative practices and other altered states of consciousness. And it usually looks at experiences that are quite short and tries to help people become aware of different facets of the experience. It's been developed by a French researcher called Claire Petit-Mangin, sorry, I mangle her surname, and it comes from Pierre Vermeer's work as well as other sources, and it helps participants to describe experience in more detail. And these descriptions could provide important therapeutic material to be used within a broader therapeutic perspective. And we used it in the context of research with 5-MeO-DMT, which is a short-acting psychedelic tryptamine. Its name officially has been changed to mebufotenin last year, but still most people know it as 5-MeO. And it's classic psychedelic, acting mainly via serotonin 2A and 1A receptors. And it has a unique subjective effect profile. And before starting research, I spent a lot of time looking at the literature about experiences with 5-MeO-DMT and how people describe them, a lot of Erowid reports and early published literature. And here is one of the first description of what it's like to take 5-MeO-DMT from an article by Wade Davis and Andrew Weil, and they describe it as the rocket ship into the void. And generally, descriptions that you find with 5-MeO-DMT online always describe those non-dual, intense experiences. And as a short introduction, where do we find 5-MeO-DMT in nature? It actually occurs in many, many plants, but in very small amounts, similar to DMT. DMT has been found in over 100 of different plants. 5-MeO has been found maybe in 30, 40 plants, but nobody knows because a lot of these studies were done in the 60s and 70s, and there could have been mistakes in the identification. But there are 3 plant genera that's actually confirmed have 5-MeO, and some of them are presented here. So the first 2 pictures are Virola elongata specifically, and these 3 and the seed pods are from Anodonanthera peregrina, and these plants are still used by indigenous people in the Amazon as snuffs mostly. And there is also grass called phalaris, and it's been extensively researched in the context of disease that affects sheep, because that's a very common pasture grass, and it has a variable amount, depending on the variety of it, of 5-MeO and the DMT and bufotenin and other things. However, the highest concentration of 5-MeO-DMT is found in glands of this handsome amphibian, Sonoran desert toad. It's also its glands, as you can see, kind of behind the eyes. That's where it's found. And when people get it from the toad, you have to squeeze the gland, and it sprays out this milky substance. And it has about 25-30% 5-MeO-DMT of the dry weight of the secretions. 5-MeO is also found in mammals. It's endogenous in humans, and again, there were lots of studies done in the 60s when people were trying to find what causes schizophrenia, and some of the theories were around some endogenous DMT or 5-MeO or bufotenin. So there were lots of studies looking at blood, urine, cerebrospinal fluid of patients and also healthy people, and some of these studies find 5-MeO in humans. However, its role is unknown. It's also unknown when it's produced, why it's produced, where it's produced. So it's even more of a mystery than endogenous DMT. In terms of history, indigenous cultures used and still use 5-MeO-containing plants for ceremonial and spiritual use. And it's one of the earliest documented archaeological findings that finds snuffs and also pipes containing Anodonanthera material, and this was found in Puna, Argentina, and Atacama Desert in Chile. And I would recommend reading a book by Manuel Torres about Anodonanthera plants and archaeology and all these early studies. And here are some also depictions of Anodonanthera plants from Peru from around 900 BC. And as I said, there are some cultures still using 5-MeO-containing plants. However, there is a lot of controversies about toad and toad use, and currently there is no evidence about the use of Sonoran desert toads by any cultures. No matter how much people want to believe that there has been traditional use, and the use of toad secretions can be traced back to 1980s to the booklets authored by Albert Most. And there is very interesting Hamilton pharmacopoeia two episodes about trying to find the actual author of that booklet, where it's described the smoking of toad secretions. But 4 years ago, when I was just starting to work at Beckley SciTech, and we were thinking about method of administration of 5-MeO-DMT and thinking back to all those snuffs, and we decided to use an intranasal way of administration rather than more common smoked or vaporized way. And we came up with this study design in healthy volunteers, which at that time was the first-in-human study clinical trial with 5-MeO-DMT. They were single escalating doses, which is the intranasal salt of 5-MeO-DMT, BPL-003. And it's given with psychological support to psychedelically naive healthy volunteers. And I really want to emphasize, and it ties back to Michael's presentation yesterday about the importance of using psychedelically naive participants. And at first, like with many trials with psychedelics and knowing that 5-MeO experience can be quite intense, we thought we'll recruit psychedelically experienced people, but actually the ethics committee specifically requested that we use psychedelically naive participants so that it's more close to the future clinical populations. And I will also talk a bit more about participants that we had. Study was split into two phases, part A and B. It was conducted at 2 UK sites, King's College London and one of the CROs called HMR. Part A was double-blind placebo-controlled trial, which had 44 healthy volunteers who received single doses of 1 to 12 milligrams of 5-MeO or placebo, and Part B was open-label trial. And today I'm going to talk about some of the participants from this trial. And here is the treatment model. You can see that, well, not treatment because they're healthy volunteers, but a study design. You can see that participants had 2 preparation visits 1 week before their dosing, and then they had 1 integration session afterwards. They were follow-up for 1 week as well. Here are some of the results from the trial to give you a bit more context. 5-MeO was rapidly absorbed and eliminated. Median time to peak plasma concentrations was approximately 8 to 10 minutes, and the half-life was 27 minutes, so you can see it was a very short-acting, and 5-MeO exposure increased approximately dose proportionally, and bufotenin, which was not detected. And the reason why we looked for bufotenin is that 5-MeO metabolism is monoamine oxidase A mediated, but also there are alternative pathways that are dependent on cytochrome, and when it goes to the alternative metabolic pathways, bufotenin is one of the metabolites, but yeah, we didn't see it at the doses that we were giving. And also I wanted to note that the shape of this graph is very similar to the next graph I'll show you, which will be about the subjective experiences and intensity ratings of it. So you can read more about the trial in the paper that was published a couple of months ago, and there were no serious adverse events, and most adverse events were mild. Most common were nasal discomfort, nausea, headache, and vomiting. And we also used quite a lot of standard questionnaires, but yeah, just here talk about mystical experience and ego dissolution, and it generally increased with the dose, and 60% of participants had a complete mystical experience at 10 and 12 milligram doses. But in addition to all these fairly standard clinical trial things, there was also a qualitative interview. It was optional, but most participants agreed to do the interview. It was conducted 2 hours after dosing, that is about 30 minutes after people finished their experience, so it was done the experience was still very fresh for participants. It was done mostly in person, occasionally online, if I was not available. And it was 1 hour in length and mainly microphenomenological with some feedback questions at the end. Here is study participants and cohorts. So as I mentioned before, we had 1 to 12 milligrams. is the number of the participants. You see there was 6 or 7 participants in each cohort, usually 2 placebo and 4 or 5 active. And in terms of interviews, most people consented to do the interview. And here are the demographic characteristics of our participants. We had roughly equal number of male-female participants. Most participants were white, but not everyone, and it's roughly representative of the demographic of London. Also, during the dosing session, because the study was first in humans, we had a lot of measures. Participants had their blood pressure and heart rate and temperature monitored every 5 minutes, and they also had their bloods taken fairly frequently. And also, throughout the experience, there was experience sampling, so every 2 minutes, participants were asked to rate the intensity of subjective effects. And this intensity was very much associated with plasma concentrations. And also, I used these intensity ratings during the interviews to help people remember the experience and to help it to organize more in chronological order. And you can see that most people in the study reported noticing effects within first 2 minutes or immediately. They reached the peak at about 8 to 10 minutes and experienced effects up to 60, 90 minutes. And this is slightly different again from smoked 5-MeO-DMT because the onset times are slightly longer and the duration of the experience is slightly longer. And by the end of 90 minutes, most participants were back to their normal state of consciousness and were lucid and happy to do the interview. And collecting all these reports about people's experiences, I was thinking about what is the best way to classify it, how to look into it, and with my colleagues, we came out with a generic structure of different modalities of the experience. And also because we have a lot of very fine descriptions of people's experiences, we can see how each of those domains and modalities unfolds over time. So we can see and examine if people had seen any visuals with open, closed eyes, were there any auditory effects, how music came into this. We could look at various bodily effects of 5-MeO-DMT. There are any effects of the nasal spray, feelings of weight, weightlessness, transition, perceived movement, and that was very, very prominent in the beginning in particular, where people felt like they're leaving their bodies or separating from their bodies. There was very similar kind of out-of-body experience in terms of phenomenology. Various voluntary and involuntary movements. Some people were very still during experience, some people moved, sometimes aware or not of their movement, and looked at various sensations inside the body as well. Time perception was a very, very common theme where at the peak of the experience, time disappears, and there was a lot of synesthetic experiences, experiences of speaking or not being able to speak and being aware of that, and also sense of presence or reality, where people felt like it was more real than real or not, and sense of presence. And that was actually very interesting to contrast with DMT research, where with normal and N-DMT, a lot of people report presence of entities, while with 5-MeO, it was almost none of it. Nobody reported any entities or external presences. If anything, people were saying, I'm going inwards inside my mind, or if there were presences, there was more presence of people that significant people in others' lives. They were thinking about their families and could visualize and feel their presence. Continuing on the structure, there were emotions were extremely, extremely intense, and you could see their valence, whether they were positive, negative, whether it was joy, bliss, peace, intensity, also temporal dynamics, where emotions were complexity and change. And complexity, for example, people feel one emotion at a time, or all emotions together, and they can't really separate them. They just feel intense emotions. And temporal dynamics, how it goes in waves, how there is, for example, a wave of sadness, a wave of happiness, and how they overlap. Also, wakefulness, sleepiness, restlessness, movement. Wakefulness, sleepiness was a very interesting distinction between placebo and people who have taken 5-MeO-DMT. People who have taken placebo mostly say, I felt so sleepy. Also, in terms of cognition, there was thoughts or the absence of thoughts, and I looked at their content and quality as well, because sometimes people say, oh, my thoughts are more clear or more confused, or there are less thoughts than in everyday life, or they come slower. Also memories, both memories of the experience that comes in the later stages where people try to remember the peak of the experience, but also personal memories, whether recent ones or from childhood. Also insights, realizations, affirmations, hopes, intentions, desires, conscious effort, focus. For example, people were actively doing something, for example, breathing exercises, or actively trying to relax, or just being present and observing. And also very, very important modality was control, letting go, whether people were surrendering or resisting. Then metacognition, a lot of things about meta-awareness, introspection of emotional states, perceptual changes, conscious content, monitoring on thoughts or reevaluating self-concepts, metacognitive control, regulating thought flow, emotion regulation, and metacognitive feelings, feelings of knowing, of insight, difficulty, familiarity, confidence, effort, puzzlement, or confusion. And last, also different aspects of self-consciousness, unity and merging all one, awareness of external environment, of others, of study procedures. And as I mentioned, study procedures were quite intrusive, especially asking people about rating the intensity of experiences, and also the intensity of drug effects and change over time, and also reflections. And that was kind of in addition to the standard microphenomenology interview, which asks specifically about the experience and asking what happened of the experience, but a lot of people spontaneously wanted to talk about reflections, or already started this process of thinking about the experience while they were still at the tail end of the experience, and the feelings that they've changed, resolutions for future, opinions about psychedelic-assisted psychotherapy, desire to repeat the experience or not. And in terms of how the experience unfolds over time, again, there was a wide variety of experiences, but just thinking about some commonalities, especially this applies to higher doses, this is what I came up with. So the first effects that were either immediate or within first couple of minutes were the feeling of the nasal spray and feeling that something is different, but they cannot quite pinpoint what it is that's different. And there were a lot of thoughts, am I feeling it? Is it placebo? What am I feeling? And a lot of metacognitive processes as well, about checking in and thinking about what they're thinking about what they're feeling. And then the moment of change is where people decide, yeah, it's definitely something, I'm definitely feeling something different. And then there is a period of increased intensity or come up where bodily sensations become very prominent. People start feeling all sorts of sensations in their body, different vibrations, pins and needles, change in temperature, moving through different parts of their body, feeling of lifting up or sinking, feeling of weightlessness or more weight. And then people report going inwards, losing external and bodily sensations. So there's, at first, sensations become stronger, and then they start losing body sensations. at this stage also people report seeing visuals, which we did not expect with 5-MeO based on previous reports, but visuals were usually very simple, kind of blobs of light and or very simple geometric shapes. Also quite strong emotions start to come up. And again, for psychedelically naive participants, there was a lot of anxiety and fear at this initial stage because it was very unusual states and they were not sure what is going on and how it is happening. And yeah, so it was quite a strong emotions. And also people start to feel that they are going out of the room, they are not in the dosing room anymore. And also what was really important for me was this feeling of letting go and surrendering to the experience or not. Again, because those are psychedelically naive people, a lot of people really struggled with letting go, and it was a process. Not everyone, some people just relaxed with the experience. And it also ties in with their previous experiences in altered states of consciousness, maybe with meditation or other practices. But yeah, this letting go was quite a prominent theme that I would like to do further research, even looking at my own data and analyze it in more detail. And again, the change period was letting go or not, and also change in emotions from this anxiety, fear, to relaxation, to peace, to bliss, and more positive emotions. Then at the peak, that was 10 to 20 minutes, most people report feeling elsewhere, and most other things disappear. Meta-awareness disappears, thoughts disappear, external awareness disappears, body sensations disappear, time disappears, and that's the period where people often struggle to describe what is happening. And in the next slide, I'll talk more about other peak experiences. And then awareness starts returning, and that happens to different people in different ways. Sometimes it's internal sensations, people start feeling their bodies again. Sometimes it's some thoughts come in. Sometimes it's the study procedures and people become aware of them. So there is variety of how, but the commonality is awareness returns. And then with the decreased intensity, people stay in this peaceful, blissful state. They're very relaxed. The effects come and go in waves, and this was really, really common across many participants, where it wasn't just a gradual decrease in the effects, and it wasn't an abrupt return to normal state of consciousness, but it was gradual waves. People start to reflect on the experience, and this is actually where people get insights if they do. And people become aware of the music and study procedure, and that's where they start noticing the music and sometimes using it to stay a bit longer in the experience. People reconnect with their body and become more aware that they are in a trial, they're in the dosing room in a hospital. And in the end of the effect, but people report they're almost back to normal, but not quite. There is the sense of calm, and people continue to reflect on the experience, remember the experience, and try to stay in the experience. And here is the peak of the experience, and I just used the analogy of the rocket ship with the coming back to Wade Davis's article. And we have a variety of the experiences, and not everybody goes to this non-dual experience, pure consciousness, complete loss of self. Again, we don't have good terminology for it, so I just write a variety of things. But this is the sort of experience that is described as void that contains everything and nothing at the same time. It's very contentless, but also full of things, and that's the most ineffable part. That's really, we don't have many words, and where there is some awareness, but it's definitely not awareness of you as a person. Sense of self disappeared and everything merges as one. Then we also have people who go on transpersonal journeys or have archetypal experiences such as death, rebirth, various visionary journeys, and then also personal experiences where there are really intense emotions with or without reliving particular memories. Also themes of acceptance, grief, affirmations. And what I wanted to say is that these are not mutually exclusive. It's not one or the other. Sometimes people can go to a non-dual experience for a few minutes and then more personal content comes up. And sometimes it's very difficult to delineate boundaries between one and the other as well. So they're permeable. And also, sometimes at the peak, people report having no memory of the experience, where only thing they remember is this brilliant white light or everything goes black, and they cannot really, it's not that they cannot describe what happened, they actually don't remember what happened. And I spend a lot of time in my interviews trying to ask people around this experience, like what is the first thing you remember after coming out of it, what is the last thing you remember before, but sometimes it's just not possible. And next I'm going to read you some of the quotes to illustrate what I've been talking about. Control, letting go, and acceptance were really, really important themes. Let go and let the process take over. There was a bit of initial resistance because it wasn't that I didn't want to, but I was like, where is this taking me? The feeling was that I don't know what is going to do to me, what's going to happen. I felt like I was being taken over. At the moment, it's like, what's going to happen to me? Who am I in this situation? It was that intense. The feeling was initial resistance and then adapting to just let go and go with the flow. Another participant, you're telling me to jump off a board into water, just let go. There is no way. There is no lifeguard or anything. There are no floaters. I don't have anything on me to save me. Just let go into something deep that I might not come up from. That's how it felt. That was my experience. It was the whole once letting go and accepting and just being very open. You feel you can go get more out of the experience, which I believe I did. For me, once I let go and accepted, I was very much at one. There was definitely that moment where you definitely feel that's not imagining or thinking it. It's happening and you're aware of it. Sometimes you're aware, sometimes you're not. You're not understanding what you're seeing or doing, but it's a conscious moment. There are two real conscious moments when you're making a decision, and that's between letting go and not letting go, and then this point here. And as I mentioned, dynamic nature of the experience. Where it's not always a challenging experience or a blissful experience. They all can be within the same experience. There was a moment in time where I was conscious of a change from me going from being quite anxious, looking around the room, to closing my eyes and just taking myself back and taking deep breaths in and actually feeling a lot more calm, and there was definitely a sense of tranquility and serenity. It helped having that preparation talk with psychedelic monitor in there to encourage letting go. And I just think because it's such an alien thing to do, your body is fighting it, fight or flight to some extent. It was difficult. I felt it was difficult to go with it. I certainly was feeling a lot of emotion. That was one of the main things from the whole thing. After the panic, which was part of it, yes, the emotions just coming out and thinking about family and reflecting on life as well as reflecting on something. Why should we just merely be going forward? Emotional intensity is something that I cannot emphasize enough with 5-MeO-DMT. People experience the whole range of emotions, sometimes all at once, or particular emotions. And people describe it in very physical terms as well, and they feel them very, very strongly in an embodied way as well. And one participant said, I've seen the emotional fabric of being. I just started to feel different emotions. It's really hard to explain. I don't know if I can call it sadness or anger or fear or happiness. I don't know. I just felt all kinds of mixed emotions, and it was in waves. I still don't know. I don't understand it. I don't know what I felt. What I can say is I felt intense feelings, the highest I've been happy, the highest I've been upset, the highest I've been whatever in the past. It was just intense. After I saw colors and stuff, I had this immense feeling of calmness just come and take over. It was very intense in the sense that it was emotions I've never felt before. Emotions I never felt before. It was complete certainty. I never had a feeling of 100% at peace, 100% tranquility. It was emotions taken to another level. You feel it so intense, and you are so sure of it, like there is nothing else. Nothing else is real, only what you're feeling is real. And here are some examples of the sense of unity and oneness. Feels it's not just me, beyond the world, beyond everything. All was one. There were no hard boundaries, no self. I definitely feel as though you feel like the world was one. If you thought about something in particular, whether it's your family or wider community, the world or environments and animals, it's definitely all one thing. It becomes one. You feel like there are these hard boundaries between, whether it's countries in between, you live on that street, I live on that street. We all live together in this existence. That's how it felt. You're considering existence, not this divided nature. And here is one of the experience of oneness from a participant who was a very experienced meditator, which was actually quite rare in our sample because most of our study participants were recruited from the CRO, and they were recruited from the pool of participants who participate in a lot of clinical trials and often for money. So it's quite an unusual for psychedelic trials where a lot of people come there because they're interested in psychedelics or altered states of consciousness. Everything came together. The intense sensation of experience in the body, the intense emotion, the crying, the kind of oneness with everything, but not in a way I experienced before. I have a background in meditation, but it was very different to that. It was a lot more intense, I guess. It was like being, it stopped being. As it built up and at the peak, it was like being, I don't know, a really high frequency vibration, like a gong or something, and kind of being shaken rather than dissolving into it and everything. There was no separation in the peak, which is this kind of space I've had the glimpses of through meditation, this huge expanded consciousness. The main thing I was aware was just the vibration of it. It was more like, I don't know if that's quite right, but not quite like a black hole. It was small and intense, but also it was everything at the same time. It was more like a superheated neutron star than expansive infinite space. And so my consciousness, I feel, also got sucked into this high vibrating, intense, dense thing. And very much connecting to Ross's talk yesterday was this feeling of connection at different levels, whether it was connecting to oneself, one's body, one's family, one's nature, the world at large. There were different levels and different people experienced it differently. And there was one person who was religious, who had really strong connection to God. I was feeling very in tune with the universe, if that makes sense. I was connected to a higher being other than myself or anything in the room. I was very much in tune with that. That gave me a sense of being secure and safe and assured that I will be okay. I knew 100% I was safe. I felt more connected with other people in my life. It felt like God was there. He just pulled you through it. I think something that's holding us attached to reality is definitely a belief. I think having faith can bring you back to understanding, accepting, and surrendering. You just can't hold on to your faith. That's something that was like a thread between reality and whatever that was. I felt God more like connection rather than presence. It's just a sense of oneness, like you don't feel so separated and connected to something bigger than yourself. Because in that moment, prior to that, maybe I have felt helpless a bit. It made me feel like I wasn't alone in there. It just felt like I was part of it. It felt it was very much inclusive, I think. I didn't just feel it, I was part of it. And sometimes people don't go to those mystical experiences of oneness at all. They relive particular personal memories or come to think about various things in their life. So, for example, my dog died recently, and I remember that. And then, obviously, that made me really sad because I was there with her when she died. And just powerful family moments that have happened recently. And then I thought about my girlfriend and my best mates and wanting to see them and hang out and talk about how I feel. Strong emotions. But even weirdly, the one about my dog dying, as I was remembering her, I didn't feel distraught about it, you know. I was remembering her dying in my arms, this big old dog, and it sucks, but I remember not wanting to be sad about it. I just remembering her, I came to be at peace about it. And some people had transpersonal experiences. I felt in the womb and all of that. It's something that will take months on end. It's just feeling. It was just all-encompassing. I do recall at one point feeling this, the female energy, the female form. It was duality of man and everything in between, hence the surrender. And I think I kind of channeled it and brought some of this feminine. I was born. I felt very much like I was newborn, like I come to existence and then structures start to formulate around me. So it was very much a visionary journey with a lot of content. And some people had quite challenging experiences, and some even really struggled. And for some people, these challenging experiences were something at the end that was very beneficial, but we had a couple of people that didn't know how to make sense of the experience and what it is, and they just came out of it thinking like, wow, that was awful, I'll never do it again, and not maybe later in the integration when they start to make sense of it. But yeah, for example, it was crazy. It's like something happens to you, like you're in an accident or something really bad happened and you're in a kind of trauma, like a traumatic experience. It's crazy. There is a sense of being through trauma that gave me tears, maybe my body go into some kind of shock. And this participant is actually quite interesting because the night before the 5-MeO dosing, that participant watched a whole season of Stranger Things, and during the experience, what happened to him is was transported to one of the episodes and felt like there is a strange demon taking over him. So again, emphasizes the importance of setting and making sure that before the experience, you don't do this sort of things. And he was warned about it in preparation, but I guess didn't take it seriously. And some challenging experiences involve fear of dying. For example, I was scared. I remember I was aware I was on medicine, and I was like, I want it to end. But it's too late. They can't do anything. I'm too sick. I'm going to die. So yeah, it was a lot of fear of death or fear of going somewhere where they will not come back or will not come back the same. And many people, because of this fear, were not able to surrender and let go to experience. And there were some and disappointing experiences, even at higher doses. And a lot of it was, again, due to people's expectations. If they watched YouTube videos of people talking about 5-MeO experiences and hoping they will get this transformative experience or go all the way to everything is one and it will change their lives, but in reality what happened to them is they've seen some visuals, felt body sensations, but not much else happened. I didn't go where I thought I would. Like in my head maybe I disappear, but I was also controlling. As I said, I think also because it goes with expectations that come into doing this. I was like, man, I'm not going to get opportunity like this because I know about people that this has helped cure all sorts of things. It's not about mental illness, it's about transformation, but I want my own experience. I think that's when my disappointment was, because I wanted to get whatever it was that people experience. I wanted to be part of that group and be like, yo, this thing changed my life. It made me think of things and gave me perspectives that I've never thought of. I think I said, is that it? Because I think I wanted more. I felt underwhelmed. I was a bit disappointed. I was hoping, but didn't get me to the plane I thought it was going. But I definitely experienced something. So yeah, we had some participants, even at higher doses, that had this feeling of disappointment. And this, again, emphasizes the importance of preparation and managing people's expectations. So it's not just the hype that you are going to go into those transformative experiences. It's whatever it is that happens to you. And a lot of people say how important was psychological support and preparation, even for healthy volunteers. And the presence of psychedelic monitor there in the room, also the sense of touch and being able to reach out to somebody for support. And here are just some themes that felt salient for participants that I would hypothesize in patients would be of therapeutic relevance. Feeling connection with family and loved ones, resolving to spend more time and be more loving towards them, releasing repressed emotions, various types of emotional breakthroughs, connecting to something larger than oneself, sense of unity and expanded consciousness, reconnecting with one's body, various somatic experiences, reconnecting to God, higher powers, reaffirming one's faith, acceptance of various aspects of oneself, discovering deeper aspects of oneself, feeling awe and beauty, that was very important too. Insights into coping mechanisms with adverse events in life, feeling comfortable and safe to discuss traumatic experiences that came up. We had a couple of participants that relived very traumatic memories, feeling heard and understood, and some of them never talked about it before with anyone. Re-experiencing memories and feelings of joy of childhood, thought long forgotten, experiencing peacefulness and optimism, and again reconnecting to childish optimism, confronting one's fear of death through experience of death and not letting go, visualizing personally relevant images, going on inner journeys, rediscovering inner strength and resilience, insight into role and nature of emotions, insights into how to stop bad habits, encountering inner child, answers to existential questions, positive affirmations, insight about consent and feeling empathy to women, committing to learning to meditate, relax, be healthier, spend more time in nature, experiencing joy reconnecting to a parent. Participant felt estranged from accepting and processing grief, and just the ability to let go of control and just be. A lot of participants said, like, I live my busy life, my thoughts are always there. Just this experience of not having any thoughts, just being at peace, was really, really eye-opening. And something that I don't have time to go into it, and that was a work by my colleague Raphael Millier. We also run machine learning, natural language processing model on the transcripts of experience, and came up with, I guess, an automated way to do this qualitative analysis. And yeah, I encourage you to read the paper when it comes out. It's really interesting. And just to add a couple of final slides, microphenomenological interviews provide more reliable and fine-grained descriptions of subjective experiences than existing, certainly quantitative measures, but also most of the qualitative interviews. They also help participants to remember the experience better, facilitating subsequent integration. And that's a lot of feedback I got from participants and also therapists later, how useful it's been for a participant after the experience to sit down and try to think about what happened in the experience. Also, it's direct feedback on the trial and agility to improve and change, where we get feedback from one cohort and apply it for the next cohort. That's very useful to prepare future participants and also for therapist training, and those are very practical applications of this research that Beckley Psytech used, and now we use some of the insights from the healthy volunteers in the phase 2 trials with treatment-resistant depression and alcohol use disorder. And as I mentioned, it also allows to separate actual features of the experience from people's interpretations of it, and to understand what it is that within experience itself that contribute to therapeutic outcomes. And of course, integration and making sense is really, really important, but it's a separate piece to that puzzle. And in conclusion, by focusing on experience and combining it with neurophysiological measures, we can bridge explanatory gap and shed light on very interesting aspects of consciousness. Specifically, 5-MeO can illuminate aspects of consciousness related to emotions, somatic sensations, different aspects of the sense of self. And it can also be applied in research and therapeutic contexts. And I want to thank study participants. Without their courage and their willingness to share their experience, I wouldn't be standing here. But also my colleagues, Raphael, Fiona, and Matt, who work with me on this research, teams at HMR and King's College London, and clinical operations team at Beckley Psytech. And thank you very much for ALPS for inviting me to speak here. Thank you very much.
Thank you. Thank you for taking us through those experiences. We have time for one question.
Thank you. It's me. Study and report. Can you hear me? Oh yeah, it's working. I wanted to ask you questions related to MAOI interaction, because from online forums I've read that you should never use MAOIs with 5-MeO-DMT, which is maybe the wise thing to do, but wanted to ask you if you know more details about it. And also about reactivations, because in my personal experience, I've had reactivations after using 5-MeO-DMT vaporized at higher doses such as 10 milligrams to 15 milligrams. And as far as I understand, the phenomena of reactivation happens depending on the route of administration, right? So for instance, if you vaporize, it's more likely to cause reactivations. I wanted to ask you if you have been following up with these people, because sometimes when you have these reactivations at night, it can be scary. I would imagine, for instance, if people who are psychedelic naive, to have reactivations, you know, sometimes you wake up in the middle of the night and then you have to kind of ground yourself that you're going there again, so to say. So I just wanted to, yeah.
That's a very important point. With reactivations, we had several people who experienced them. And most people who experienced them described them as a positive thing, as something that they were actually enjoyed and were looking forward, and brought back the memories of the experience. But again, there were healthy volunteers, and so yeah, it's hard to say how it will be in patients or more people who had more difficult experiences and still struggling with it, and if they get reactivation of that, what will happen. So we need more research on reactivations. But yeah, in our sample, maybe 3 or 4 people reported reactivations, and they were mostly positive. And coming to your first part of the question about pharmacokinetics, yeah, generally it's not advised to take 5-MeO with monoamine oxidase inhibitors, because that shifts metabolic pathway towards cytochrome 2D6 based, and that's where you get bufotenin as metabolite, and that prolongs the experience, make it more intense and more unpredictable. So that's the pharmacokinetic reason why it's not advised to take it with monoamine MAOI inhibitors. But there are certainly people who do and did and wrote about their experiences. For example, Jonathan Ott has described in detail this combination. And actually, in the early 2000s, used to give out 5-MeO with monoamine oxidase inhibitors at conferences even. But again, all this is anecdotal. And also, there are several reports of toxicity and serious events associated with 5-MeO, and they are pretty much always when 5-MeO was taken in combination with monoamine oxidase inhibitors. So yeah, I wouldn't recommend it.